Hey guys, if you're like me, you're on constant poop patrol. You're looking around the yard, finding out what kind of stools we're having with the dogs, with the cats, looking in the litter box, and you're just every day kind of thinking about it. And you're actually thinking, wow, I'm thinking about my dog's poop more than they are. I'm here today to talk about inflammatory bowel disease. It's this kind of big umbrella diagnosis, which really isn't actually a diagnosis at all. So whether you get a diagnosis of gastritis or pancreatitis because your pet is vomiting, or you get a diagnosis of colitis, gastroenteritis, hemorrhagic gastroenteritis. I mean, there's multiple causes for vomiting and diarrhea, and some of them are they're not inflammatory bowel disease, right? There could be cancers, tumors, all kinds of stuff. But I'm here to just talk about inflammatory bowel disease. What is inflammatory bowel disease? In my practice, I deal with it a lot, and we have really excellent success rate. And I would say that's true for most veterinary acupuncturists and actually veterinary herbalists. It's kind of like an abscess for Western medicine, right? For us, it's pretty simple. You have to take away the inflammatory causes, and then you have to heal the intestinal tract. So you have to do both. Healing the intestinal tract, that's done with herbs. They are fantastic at it. Chinese herbs, Western herbs, they work at different places in the intestinal tract. But first I want to talk about the causes. What is going on? Why does your pet have diarrhea all the time, can't have a normal stool, has a lot of discomfort, maybe gas, could even be constipation, right? Could be vomiting. A lot of cats that get constipated have vomiting. There's kind of this vagal reflex that happens. So I am here to tell you that a lot of the problem is food allergies. I started studying this about over 20 years ago, and I treat a lot of food sensitivities, and food sensitivities are really the number one cause of inflammatory bowel disease, hands down. And there's almost not a case of inflammatory bowel disease that doesn't have some food sensitivity component to it. Of course, food allergies and food sensitivities are one cause. The other causes could be anything between, damage, parasitic damage when the dog was younger, the cat was younger, all the way to genetic predisposition. And food allergies, and in my mind, sometimes I think, wow, this is maybe the way you should act, what the normal response should be when you're being fed food that's not healthy. Maybe, the dogs and cats that aren't reacting are more the abnormal ones. And we are feeding these pets factory farm food. We're feeding ourselves factory farm food. We're feeding ourselves GMO'd food, heavily chemicalized food. What is a normal reaction? A normal reaction might be inflammation to all of that, right? And so this is a big issue in America. It flies against the corporate model of making money, right? Where you just put all these animals into a small, tiny space, and then, after you basically process the animals, and then what's left is a healthy food stuff for your pet, or is what's left not healthy? So when we look at food allergies, it kind of follows the line of factory farming. Not always, but pretty well. We have chicken, we have egg, we have grains. So what are we hybridizing? What are we GMOing? And we have beef. And so if you look at kind of what are the foods that we're kind of messing with the most, it's those foods. It's very difficult, to get actual protein that your pet's not reacting to. So what's happened in the veterinary industry is they say, okay, we recognize there's protein allergies, but what we're going to do, instead of going to a novel protein or a protein that's not factory farmed, is we're going to take that chicken and that egg and that grain and everything the pet is allergic to, and we're going to dump it in hydrochloric acid, and we are going to hydrolyze the proteins. And when we hydrolyze the proteins, sometimes the pet then can't recognize them as much. And we can get those symptoms to go away, and they could be skin symptoms too, right? We're talking about IBD, but could be skin symptoms, any inflammatory process in the body. But what happens over time is those ingredients aren't very healthy, and so it makes the dog or cat prone to things like cancer and other things, because you're basically taking away the body's reaction, which is to reject these foods. So what's happened in our area anyway is we have a raw food co-op which provides people at lower cost, still pretty expensive, but exotic proteins. You know, you see all these exotic proteins like kangaroo and all these things, and emu and partridge and guinea hen, and it's like, what can we find that's not factory farmed? What can we find that has natural rearing, you know? And there's a whole Ayurvedic belief in that too, that what we do to the food ultimately affects us. Are the animals stressed? Are the poor pigs stressed? That's another one that's a big allergen. In these big high-rise factory farm situations that are just polluting the environment. Are the animals stressed in that environment? Well, those hormones, those stress hormones, those chemicals, those antibiotics, those hormones, all of that goes into your pet who's being fed that. So it's super just kind of sad, but yet we need to just grapple with that reality of why are we having to go to all these exotic proteins. By the way, a quick little joke. My friend who practices in Australia says, "What's with all these kangaroo allergies?" And it made me laugh, because we just don't have that in America. You know, we have chicken allergies. So anyway, so we treat a lot of food allergies just by doing muscle testing, figuring out what these pets are allergic to, and customizing diets that avoid those allergies. The second most important thing, other than recognizing what the allergens are, is realizing that because the pet is reactive, they're going to start reacting to the new protein. So that's why we can only do one protein for 1 month, and then we switch. Why do we switch? We do a bait and switch on the immune system. We switch the protein before the pet starts reacting to them. And we just guess at 1 month. Some dogs can't go more than a couple weeks. Other dogs can go more than 1 month. And it means, because what that ultimately means is if the pet is eating something that even isn't that factory farmed or isn't factory farmed at all, if they're exposed to it for a long enough time and they're reactive enough, they're going to start reacting to that new one. So that's why we have guinea hen allergies, partridge allergies, emu allergies. It's because you fed that protein too long. You needed to switch. And you don't want to, feed chicken treats, and the treats are often what sink people in IBD, because you can usually control IBD symptoms entirely with the diet. And you can put your comments and suggestions and questions in my little little questionnaire thing at the end, because I'd like to know what your guys' experience with this is. Can you control the symptoms of IBD by working with your pet's diet? Another big problem with factory farming is fish. And it should be that they only react to fish meat, but instead they react to the oil too. And so we see a lot of fish oil allergies being a contributor to IBD. So I mentioned that we do acupuncture and we change the diet. Those are really important things for treating IBD holistically. The next thing we do is we use herbal medicines. Boy, that's a huge talk all by itself. Just a quick version of it is slippery elm and marshmallow are fantastic little band-aids for colitis and even gastritis and ulcers. I love treating ulcers with marshmallow. At least that's in part of my formula. And I have a whole herbal video on YouTube on marshmallow, how to grow it and how to extract the medicine from it. But those only help in some cases. And the cases that they help, it's very common sense, is where we have ulceration or sort of damage to the intestinal integrity, right? But if we're working with the pancreas and we're working with, like, say, the chief cells and all of the other aspects of digestion, we're probably not going to get very far using those demulcents. We're going to look at more the Chinese herbs like 4 gentlemen, 6 gentlemen, 8 gentlemen. 8 gentlemen is a fantastic Chinese herbal combination, very ancient formula to help heal pancreatitis and help the intestinal tract recover. In Chinese medicine, we're looking for what we call spleen and stomach tonics. In 5-element theory, that is, we're trying to strengthen the earth constitution through herbs. And so in Western herbs, I did a video on tummy tea, how to heal your pet's gas and enteritis and gastritis using just simple old Ayurvedic herbs. So in that video, we talk about caraway seeds, fennel seeds, I think anise seeds, and making that into a tea. So that can help heal the intestinal tract. So there's so many healers, herbal healers for the intestinal tract. It would just take hours and hours to talk about all of them. But I do like to put a little bit of those in the vegetable component of all my herbs or all my diets for IBD. So you'll see in my diets for IBD, there's a little bit of fennel bulb, there's a little bit of basil, there's a little bit of dill. There might be a sprinkle of cumin or coriander, and these are all our natural spleen tonics that have amazing results. So the next component I'll just talk about quickly at the end, it's like, sorry it's so long, it's a big topic, is the biome. The biome, it has to do with the intestinal bacteria that's healthy in the intestinal tract, right? So we're looking at trying to keep the intestinal tract happy and healthy and all the biome happy and healthy. Why? Because 70% of the immune system is controlled by the intestinal tract. There's all these little lymphatic things along the intestinal tract called their Peyer's patches. And what happens is the bacteria, the healthy bacteria, interacts routinely every day with blood cells on the intestinal barrier and interacts with the lymphatic. And what that does is it sends nerve signals up to the brain and tells the brain, hey, you want to eat this, you want to eat that. These things can get really sort of disjointed when it comes to some of our addictions that we have, like to carbohydrates and sugars and oils and salt. But if we were left to our own devices without the media telling us what Cheetos we need that month, these things would really control and help with our intestinal biome, right? It's why we eat some things and we feel good, and we eat other things and we don't feel so good. Because when the biome is unhealthy, we're going to know it. And we're going to know it through the nervous system's interaction with the brain. So that's why they call, I think, the intestinal biome the third brain or the second brain or whatever it is. It's another nervous system that's complex and works with the other aspects of our nervous system, our spinal cord and our brain. And so there's an interaction and an interrelationship between the dog and the cat's intestinal biome and health and the brain. And I know in humans it can be related a lot to depression, like what's your psychological state. And this kind of goes into the old thing of Chinese medicine. When we have intestinal issues in Chinese medicine, we have disruption of the earth constitution, we have worry. There's too much worry, and that attacks the pancreas, it attacks the pancreatic enzyme production and the entire intestinal tract. So worry and so that comes back to, wow, we really need to be centered. We need to work on our mindfulness. We need to work on everything that we can spiritually, and even us personally, our spirituality, our centeredness, our groundedness, our lack of worry, that helps our animals because they are just sponges, right? We're just teaching them all the time how to interact with their environment. We are teaching them. And I guess sometimes they're teaching us too. So anyways, a long, big discussion about IBD. I hope it helped. If you guys have any other questions, anything I hadn't covered. Oh, there is one thing I hadn't covered. I'm sorry, throw this in there at the end. Exocrine enzymes. So when you sometimes people don't know the difference between a probiotic that they're getting and a digestive enzyme. They're two drastically different things, but sometimes in some products they'll put them together and just like, I don't know, it's like a catch-all or something. I'm a big proponent of probiotics. I like to get it from the food mostly, and there are a few products that we use here at the clinic. But over here on the other side, let's go back to the probiotic part. Goat kefir, goat yogurt. We kind of go away from the dairy part with the cow dairy, and we go into the more goat types. There's fermented fish products if the dog is good with fish. There's sauerkraut. So those are also natural things that can help with the pet's digestion and probiotic situation without buying a product. But on this side, the pancreatic enzymes, that's anything that ends with an ACE. So lipase, protease, cellulase, and those are like, I only use digestive enzymes in cases where the pet is very, very deficient or old, because when you start using them, you are going to slightly, if not more than slightly, shut down the pet's own digestive function by reducing the amount of pancreatic enzymes the pet's going to create. So it's basically like, if you give them that if you give them that digestive enzyme, then why should they create their own, right? So that's why I try to strengthen the spleen with herbs, do the biome support, do the food, do the acupuncture, and I'm doing everything I can so that I don't have to go on digestive enzymes. Because a lot of pets that go on digestive enzymes, they get better. It's kind of like the whole omeprazole trap, you know? You feel better, you get better, but are you really better? You didn't fix your diet, you didn't do anything about your lifestyle or your thoughts or anything like that, you know? So then you just take digestive enzymes as a crutch. So anyway, all right, you guys, sorry for the big explanation. There's probably way more to it than that, but this is just a little kind of snippet of what I do every day. Thank you so much. If you guys want to help us, subscribe, just hit that subscribe button. It's free. You know, share, comment. What do you guys think about inflammatory bowel disease? And thank you so much.